Debunking Common Health Myths with Scientific Evidence. Welcome to our channel where we give you healthy education and scientific evidence to help you make your healthy choices. In this video, we are going to give you 8 healthy myths that have been going on for long and detailed scientific evidence that prove these myths to be just myths and nothing more. Without further ado, let's get started. Number 1. The myth that taking daily multivitamins prevent chronic diseases. In 2013, a study published in the Annals of Internal Medicine reviewed 27 clinical trials involving a total of around 450,000 participants. The review aimed to evaluate the effectiveness of multivitamins in preventing chronic diseases such as cancer and cardiovascular disease in well-nourished adults. This comprehensive analysis was led by the U.S. Preventive Services Task Force, USPSTF, and involved researchers from Johns Hopkins University, including Drs. Eliseo Gwaller, Lawrence J. Appel, and Edgar R. Miller III. The study concluded that multivitamins provide no significant benefit in preventing chronic diseases or cognitive decline in healthy individuals. Specifically, trials involving thousands of participants over several years showed no reduction in cancer, heart disease, or cognitive decline due to multivitamin use. The overall recommendation from this research was that most people who are not nutritionally deficient do not benefit from multivitamins, and in some cases, certain vitamins like beta-carotene and vitamin E might even increase health risk. Have you been taking multivitamins? Are you going to continue taking them? What are your thoughts? Please let us know what you think in the comment section below. Now let's move on to Number 2. The myth that sitting for a long time is harmless if you exercise. A 2015 study published in Annals of Internal Medicine was a meta-analysis conducted by Dr. Avarup Biswas and colleagues from the University Health Network in Toronto. This research examined the effects of prolonged sedentary behavior on health outcomes such as heart disease, diabetes, cancer, and mortality. The researchers analyzed data from 47 studies involving over 850,000 participants, making it one of the most comprehensive analyses of its kind. Their findings showed a strong correlation between extended periods of sitting and an increased risk of cardiovascular disease, cancer, type 2 diabetes, and all-cause mortality. These risks were evident even in people who engaged in regular physical activity, highlighting that exercise alone cannot fully offset the negative effects of prolonged sitting. The study concluded that reducing sedentary time, in addition to maintaining regular exercise, is crucial for preventing chronic diseases and improving overall health. Number 3. Gluten-free diets equals healthier diet. The 2017 study published in BMJ examined the relationship between long-term gluten consumption and heart disease risk in non-celiac individuals. The research team, led by Dr. Benjamin Lebwohl from Columbia University and Dr. Andrew Chon from Massachusetts General Hospital and Harvard Medical School, analyzed data from 2 large cohorts, the Nurses' Health Study and the Health Professionals Follow-Up Study. These cohorts included approximately 110,000 participants who were monitored over a 25-year period, from 1986 to 2010. Participants completed detailed dietary questionnaires every 4 years, which allowed the researchers to estimate their gluten intake. The study excluded individuals diagnosed with celiac disease and divided participants into 5 groups based on their gluten consumption. The key finding was that there was no significant association between gluten intake and coronary heart disease, CHD, risk. They concluded that gluten-free isn't beneficial without a medical need. Number 4. The myth that moderate drinking improves heart health. A study published in The Lancet, 2018, by the Global Burden of Disease Alcohol collaborators analyzed data from 195 countries and found no safe level of alcohol consumption. The study examined data from 195 countries between 1990 and 2016. The study used a meta-analysis approach, incorporating data from 694 sources on alcohol consumption and 592 studies on alcohol-related health risks. This large-scale analysis assessed 23 health outcomes, including various types of cancer, cardiovascular diseases, liver diseases, and injuries from both intentional and unintentional causes. The research highlighted that even moderate alcohol consumption increases the risk of diseases such as cancer and stroke. The conclusion that no amount of alcohol is safe was reached after evaluating both the potential health benefits and the harms, with the harms consistently outweighing any minor benefits, such as reduced risk of heart disease. If you find this video helpful, consider liking it and subscribing to our channel. This will motivate us to continue making videos like this. Number 5. The myth that low-fat diets are the best for weight loss and heart health. Study. The Women's Health Initiative, 2006, conducted a large-scale study with 49,000 women, finding that low-fat diets did not significantly reduce heart disease or weight loss compared to balanced diets. The Women's Health Initiative, WHI, Dietary Modification Trial, 2006, was a large-scale study involving over 48,000 postmenopausal women aged 50 to 79, aiming to examine the impact of a low-fat diet on heart disease, cancer, and weight loss. Participants were randomly assigned into two groups: the intervention group, low-fat diet, and the control group, usual diet. The trial ran from 1993 to 2005, with results published in 2006. Despite reducing fat intake by around 8 to 10% compared to the control group, the low-fat diet did not significantly lower the incidence of heart disease, cancer, or aid in substantial weight loss. The researchers noted that while participants adhered to dietary changes, the expected health benefits were not observed, raising questions about the effectiveness of low-fat diets in disease prevention and weight management. This study concluded that healthy fats are essential, and extremely low-fat diets can be detrimental. What do you think about this myth? You believed it, didn't you? Let us know what you believed and what you didn't in the comment section below. We are moving to Number 6. The myth that using cotton swabs for ear cleaning is safe. A study published in JAMA Otolaryngology highlighted the dangers associated with using cotton swabs to clean the ear canal. This research emphasized that instead of removing earwax, cotton swabs often push it deeper into the ear canal, leading to earwax impaction, irritation, and an increased risk of infections. The study also noted that improper use could damage the sensitive ear canal lining and, in severe cases, perforate the eardrum, potentially leading to hearing loss. The research involved analyzing case data from emergency room visits related to ear injuries, revealing that a significant proportion of these cases were caused by cotton swab use. Although the specific number of data points isn't disclosed, it appears the study was based on a comprehensive review of clinical cases over several years, providing strong evidence for the risks associated with this common practice. To mitigate these risks, experts recommend using safer alternatives, such as wiping the outer ear with a damp cloth or consulting a healthcare provider for proper earwax removal. The study underscores the importance of public education on ear care to prevent avoidable injuries. Number 7. The myth that coconut oil is a miracle food for weight loss and heart health. The 2017 American Heart Association, AHA, advisory reviewed studies on dietary fats and their impact on cardiovascular disease, including coconut oil. The review was conducted by a panel of experts led by Dr. Frank Sachs and evaluated the effects of various fats on LDL, bad cholesterol. They found that coconut oil, due to its high saturated fat content, raised LDL cholesterol levels similarly to butter and other saturated fats. The panel reviewed multiple clinical trials and observational studies, concluding that replacing saturated fats like coconut oil with unsaturated fats, such as those from vegetable oils, lowers the risk of heart disease. While the specific number of studies involving coconut oil wasn't isolated, the overall evidence from studies involving thousands of participants across multiple trials pointed to the cardiovascular risks associated with saturated fats, including coconut oil. Number 8. The myth that antibacterial soaps prevent illness better than regular soap. In 2016, the U.S. Food and Drug Administration, FDA, issued a final rule banning the use of certain antibacterial agents, including triclosan and triclocarbon, in over-the-counter consumer hand and body washes. The decision was based on the lack of sufficient evidence to show that these ingredients are more effective than plain soap and water at preventing illness or the spread of infections. The FDA found that manufacturers failed to provide data proving the long-term safety and effectiveness of these ingredients. Some studies suggested potential health risks, such as antibiotic resistance or hormonal disruption, from prolonged exposure. The rule only affected consumer products used with water, such as hand and body washes, and did not apply to hand sanitizers or antibacterial soaps used in healthcare settings. These examples show how evolving research corrects misconceptions and improves public health recommendations over time. We hope you enjoyed this video. If you did, consider liking and subscribing to help our channel reach a bigger audience. See you next time.